Good evening. How are you? How has been your day? Now, if you can hear me, then just know that I would not be responding because we have ended the live stream. You understand? Yeah. But if you are here, you are live with me, you can drop your comments and I'll respond to you. I can see we have some people already online. We have some people online. Hi, good evening. How are you? Good evening. Where are you joining me from? We are live on Facebook and we are live on YouTube. So if you have any comments, you can drop your questions tonight. Huh? Yeah, I'm going to be done very soon. In the next 30 minutes, I'll be done with the live stream. Good evening, everybody. Yes, Oluchi, good evening. Olawale, good evening. I see you. Do me a favor, share the live stream. Share the live stream on Facebook, share the live stream on YouTube. Feel free, ask me anything. Ask me anything. Tonight, I just want to talk. I just want to talk. Um, Good morning, good afternoon, good evening, wherever you're joining me from. My name is Dr. Frederick Unubohai. I always tell you good life now sense. Now, if this is your first time joining my live stream, you're welcome. It's a privilege having you here. Welcome. We have somebody joining us from YouTube. Classic World, how are you? How many people do we have on YouTube joining us tonight? Hi, good evening. Welcome, everybody. Oh, yeah, like this video and share. Like and share. Good evening, Rita. Good evening, Joseph. Feel free. Hmm? Ask me anything. Ask me anything. Ask me anything. Ask me anything. Feel free. Ask me anything you want to ask me tonight. Yeah, let's gist. I want to gist with you. I want to talk to you. Why is somebody putting the sad emoji? Who's that? Or putting the angry emoji? Who's that? Who's doing that? Who's putting the sad emoji? Hi, good evening. Helen, I see you. Mercy, I see you. Genevieve. Genevieve says, hi, good evening, Dr. Fredostar. Oh, yeah, ladies and gentlemen, I have noticed something. Victor on YouTube. Victor, how are you? I have noticed something, ladies and gentlemen. I come online, respond to comments, questions, and then I beg us to share the live. Nobody is sharing. Nobody is sharing. Very few people are sharing the live stream, clicking the like button. I don't know why. Hmm? But at the same time, everybody want to call you. Everybody want to talk to you. Come on. Somebody says, is it true that eating okra with the seed is not good in man's health? There's a research that said eating okra can affect a man. There's a research that said that. Hmm? Just no, the research is not that much on it, but there's a publication on that. Ask me anything. Drop your comments. Please, no private chats. Hmm? No private chats. No call. I'm fine. Okay, I see you. Talk to me, everybody. Ask me your question. Share the live stream. Let's go. Oh yeah, oh. Let's go. Grace. Hey doc, is Clomid advised outside doctor's prescription? What are the dangers? So the answer is no. Never you take Clomid outside a doctor's prescription. Never you take Clomid outside a doctor's prescription. Full stop. Never. Clomid is not paracetamol. Clomid is not vitamin C. Do you understand? Yes. I always share your live video. Asibo Helen, thank you so much. God bless you. Thank you so much for always sharing my live. Some people will be listening to me right now. They won't share stream. No matter how much I beg them, No matter how much I beg them to share, they won't share as well. How old can a patient after kidney transplant live? I don't know. Depends. There are many factors involved. I'm not God. There are many factors involved. Depends on other medical conditions. We call this comorbid conditions. So a kidney transplant patient can live 5, can live 10, depending on where this person is living and many factors. Please don't forget to send me stars, everybody. So when you send me stars, I give you a shout out. I think what I'll be doing this year is people that send me stars, they are the ones I'll be bringing up on my live stream. Yeah, those people who send me stars are the people I would really be bringing up on my live stream from time to time. This is my own way of also appreciating them. So you can send stars on Facebook, Dr. Fredostar official, Doctor, even on YouTube. I treated infection last month, and in this month, I'm 6 days late in my period. I need advice. And relax now, madam. Relax, relax, relax. Give yourself time. Don't worry. By the way, who treated you for the infection, sir? Because all these I treated infections, I treated infection. Who even treated you? Joy. Ladies and gentlemen, are you sharing the live stream? Please share, share, share. I cannot just be online like this. We are talking, answering questions. We are not getting your shares. Abba, eh? Ah, I want to start doing like portable. I want to start doing wala, 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 wala. Maybe that's when people will start gathering on my page and start supporting because now that one people they like. Cough is kind of common this period. What is the best way to prevent it? The best way to prevent it is ensuring that uh, you protect yourself, uh, the environment. So this is the flu season. Sometimes you might not be able to even prevent it at all. It will surely come, but what you can do is your immune system will be able to help you. If as long as your immune system is intact, your immune system should be able to handle the cough caused by viral infection. So take your vitamin C, take your water, your warm water, take your fruits. You should be good. You are doing a great job, John. Thank you. Olawale, I shared the live video. Thank you. God bless you for sharing. How can one handle quick ejaculation? Hmm. I always share. Thank you for sharing. Thank you for sharing. See, don't just be asking me question without sharing video on this page. Abba, all you care about is just come and ask and disappear. So, for quick ejaculation, you have to find out why the man is having quick ejaculation. Is it that he's not engaging in intercourse frequently? Some young men or some guys, some men have no problem because they have not been engaging in intercourse frequently. So anytime the man goes inside, he's going to pour early. The more he engages in intercourse, his performance will improve. That's number one. Number two, find out if he has any other medical condition. Hmm? Sometimes it could be psychological too. It could be mental. He has no problem, but he's always panicking. Is anxious. So you tell the guys, if you are a man and you are always having this feeling of quick ejaculation, calm down, bros, calm down. Don't be in a hurry. The Bekus know the run. The Bekus is there for you. So take your time. Don't rush. You will go inside. But the thing is this again about quick ejaculation. I don't know how many minutes does this guy last in because some young men will tell you that I go in for 10 minutes. Some will say I go in for 15 minutes, but I come out on time. It depends. Some ladies want the guy to stay in there for 30 minutes. Some young men can stay in there for 7, 10 minutes, and they are doing very well. But because everybody wants the man to last long now, then there can be problems. So, how long does he even last? Lucy, good evening. Oluwaseun, thank you for sharing. Becky, how are you? Um, well done. Doc, can a fertile woman opt for IVF in case she wants twins? Yes, she can. She can. Good life na sense. So yes, good life na sense. Thank you very much. Those on YouTube, nobody don't send me stars on YouTube. Why? Nobody has sent me super chat on YouTube. Huh? Hello, doc. What can one eat to make my unborn baby gain weight? The weight is 470 gram at 6 months. Do you Have you registered for antenatal, Ido? Ido, did you register for antenatal care? Who's managing you? Huh? Speak with your doctor, madam. I don't think your baby's weight is 470 grams. But the baby can still gain weight. Eat your normal food, please. Eat your normal food. Eat your normal food and then speak with your doctor. Hmm? Yeah. Just eat your normal food, please. Eat. Take your medications, Madam Idowu. Take the medications prescribed for you. Eat your normal food. If you have not registered for antenatal, please go do so immediately and then speak with your doctor. Yeah, your doctor. What if I drink water early in the morning? My stomach always paining me. Reduce the amount of water you take, Mr. Victor. Don't take too much. Huh? Come, has anybody sent me stars today? Nobody has sent me stars today. Nobody has sent me stars. Let me see if anybody sent stars. Okay, nobody don't send stars. Okay, oh, it is well. Can I be pregnant and still see my period? You should not be pregnant and see your period, madam. If you are pregnant and you are seeing blood, quickly go to the hospital. Quickly, quickly go to the hospital. Good evening, Lucy. How are you? What advice will you give a woman who has very small fibroid and bleeds very much during menstruation? Is there any drug for it? How do you know that she has small fibroid? Number one. Number two, if she's bleeding very much, then the fibroid cannot be small. There are other things making her bleed. So my advice for that woman would be that the woman should see a gynecologist. Let them be sure that the cause of her bleeding is not due to blood disorder or maybe fibroid or something else. Drugs, maybe they might prescribe medication for her, but the treatment is tied to the cause of her bleeding. So if you're a woman here and you are bleeding heavily, bleeding very much during menstruation, you will need to see a gynecologist. Hmm? That's the best advice for you. How are you? I'm doing very well. Oh yeah, share. In what month can a first-time mom start antenatal? As soon as you miss your period, madam, you should be starting your antenatal. This idea where people will tell you you have to wait for 3 months before you go for your antenatal is wrong. There is nowhere it is written that a woman should go for antenatal when she's 3 months or 4 months pregnant. The moment you miss your period, you should be going to see your doctor. As a matter of fact, even before missing your period, missing your period, you should be meeting your doctor. It's called preconceptional care. Hmm? Yeah. So the moment you miss your period, speak with your doctor as soon as possible. Good evening, Sharon. How many people do we have on YouTube? I have always shared. Thank you for sharing. Thank you for sharing. Thank you. Thank you. Good evening. Thank you for sharing. I just shared the video. Thank you. Thank you for sharing. Thanks so much for answering. Thank you. Thank you for sharing. Please, can one be pregnant and still see her period? I have responded, Becky. Yes, I have answered that it is not right. So if you are pregnant and you're seeing your period, quickly run to the hospital so that you don't lose that pregnancy. However, there are some women that have said when they were pregnant, they were seeing period. It's very rare. It can happen, but very, very rare. Hmm? How is everything going? Very well. I've answered now. I've answered now. You have to wait. There are so many comments here. I shared. Okay. What can cause you to urinate more frequently? Many things. Too much water intake, um, urinary tract infection, hyperglycemia, diabetes, overactive bladder. Your bladder is functioning too much. Even stones, prostate issues for men. So there are many things that can make someone electrolyte imbalance too can cause that. Thank you, thank you, thank you. Good evening, Isi. Favor, how are you? Okay, I have responded to almost all the questions here. Very good. Very, very good. Okay. I'm on YouTube and Facebook. Oh, I hope you can hear me, everybody. Good. If you have any question, medical or non-medical, ask me. What is the drug for what? Hernia. Don't come online and be asking for drug. There's no drug for hernia. Hernia is surgery. Hernia is called It's spelled as this is the spelling for hernia. This is the spelling for hernia. This is the spelling. This is the spelling for hernia. That's the spelling. Yeah. So there's no medicine, there's no drug for hernia. Hernia is surgery. If you think you have hernia, see a medical doctor to confirm your diagnosis. There is no medicine for hernia. Oh. If you want to believe me, it's fine. If you disagree with me, no problem. If you drink whatever you want to drink, you will drink all of them and then you will still go back for the surgery. Hernia is only corrected through surgery. Hmm? Yes. Agbontine, Emmanuel, Alpha. Okay. People they look me, everybody they look me. Okay, oh, they are all looking at me. Glory to God. Everybody is looking at me. Oh, okay. We are live. Okay. When I betted my twins, I did bilateral tubal ligation because I don't want to be pregnant again. Will the bilateral tubal ligation stop me from getting pregnant again, or I should take family planning? God, didn't they explain this to you, Queen? Didn't your doctor explain this to you? Hey God, I beg. Oh, who does this? You didn't ask them questions, or they told you you just want to find out again from me, madam. Eh? They tied your tubes now so that you won't get pregnant again. Full stop. I beg. Oh, what could cause body scratching? Many things, many things, many things. You can go and search it on Google. Google will tell you many things can cause body itching. Many things. Can antiverted uterus cause delay in conception? Melissa, tell me why you are asking this question quickly. Tell me why you are asking this question. It's not enough to answer this question. Why are you asking this question? Let me tell you why I'm asking you. I see many ladies come on my live stream. Let me tell you what they do. They have problems. Some of them would go and carry out tests. They will come online. They'll be reading the results small, small to me, asking me questions, hoping that I'm going to tell them yes and no. So I've been doing this for a very long time. So when I see questions like this, I want to know the reason why you are asking so that I can help you. I'm not going to tell you yes or no. Why are you asking this question? Are you trying to conceive? If yes, for how long? What have you done? Are you the only one going to see the doctor, or you and your partner? It's not enough to just come online and ask the doctor, if I do this, will I do this? Yes and no. Medicine is not yes and no. Medicine is beyond yes and no. There are many things you need to explain to people. So, madam, please help me. Why are you asking? Is it that you are trying to get pregnant? You went to the lab to carry out a test, and then somebody is telling you that this is the reason why. Have you even seen a gynae? So help me. Let me help you too. Good evening. Oh God, thank you. Good evening. Is there any drug or treatment for dark underarms caused by PCOS? Ah, most likely no. Most likely no. Most. I'm using the word most likely no. There are creams you can use though to make that area light. Sometimes it can be very dark. There are creams you can use, but the reason for that place being dark is because of hormone. Hope you know. Hmm? Hormonal changes. Yeah, that is why that area is dark. Good evening, Florence. Is it normal to see your period 2 days? Some of these questions when they ask me, the answer they my page, but people know they go watch the video. Hmm? The answer they my page. So if you have a problem with your menstrual period, I beg you, go to YouTube and watch the video on menstrual issues. You will see one video there. All your answer is there. But for the lady that asked me this question, what's your name? Cindy Boo Edoko. So the answer is this. Normally, period should be between 3 to 5 days. Normally, 3 to 5 days. Sometimes it can get up to 7 days in some women. Sometimes it can be up to 7 days. Now, when the period is less than 3 days, we are worried. So if your period has been 3 days, 3 days, 4 days, 5 days, 3 days, 3 days, 4 days, like that, and then suddenly your period is now 2 days, it's advised that you speak with your doctor privately. That would be my advice for you. But some women will tell you that they haven't seen their period all through their life for 2 days. Make una share the live stream. Eh? Share. Ah, only 5 people have shared this video. Only 5 on this. Oh God of heaven. Now wow, I know receive stars. I know receive gifts. I know receive stars. I know receive gifts. Share, and I don't want to share for me again. Ha. Now wow. Good evening. Good evening. I have a question. Please go ahead. Thanks. You're welcome. Good evening. Good evening, Akerele Alaba. Good evening, Doctor Fredostar. Good evening, Evie. Everybody, good evening, good evening, good evening. Welcome. Share, oh, share. Please share. Please share the live stream. Eh? What if the woman with 2 days period is on family planning? So you see why I say this, that there's a video on my page. I've noticed that people don't really watch my videos. They prefer to come online and ask me on the live stream so that I keep repeating the same questions over and over again. There are many things. If a woman is on family planning, her period can change and it's okay. This is why we will tell you to speak with your doctor privately, because there are many information we have to get from you. It could be that it's your family planning that is causing it, and you are okay. There's no problem at all with you. So if you're on family planning and your period is doing somehow, it might just be because of the family planning, and you have no cause to be worried. Is that okay? This is why we tell you that this platform is just for educational purposes only, not to treat anybody. I'm not here to collect the place of your doctor. Never. I'm not even interested in having patients from social media because it's more work for me. Here you get. But there are very important things your doctor will want to find out from you. So if you have problems with your period and you are listening to me now, go to my YouTube channel. The name of my YouTube channel is called Dr. Fredostar. That is the name of my YouTube channel. It's on the screen. Go there, scroll through the videos. You would see one video on menstrual issues. Watch it. I have a question. Okay, please ask me your question. Ask me your question. Um, how can one dictate cancer of any type and food to eat? How can one dictate cancer of any type? Madam, you cannot dictate cancer of any type unless you want to screen all part of your body. We have different types of cancers. There are different types of cancers. We have breast cancer for that's common in women. So if you're a woman listening to me right now, you should be more concerned about breast cancer. Also, you should be concerned about cervical cancer. Also, you should be concerned about ovarian cancer. And depending on your age, you should be concerned about endometrial cancer, also depending on your age. But breast cancer is common. So we will tell ladies, every woman listening to me, um, self breast examination, examining your breast by yourself. You should be able to examine your breasts by yourself at least once every month. If you have a family member who has had breast cancer before, you are at risk of having breast cancer. Depending on your age, from 40, 50 and above, you should be going for screening. For cervical cancer, women listening to me right now, I beg anybody will send me star. Please let me know that you have sent stars so that I can appreciate you. Please, if you sent me stars, just let me know so that I can say thank you very much. Please let me know that you have sent stars so that I can. Oh, somebody sent me 310 stars, right? Who is this? Who sent 310 stars? What is your name? Is it John? I just saw it now. John sent 310 stars. John, thank you. I'm checking with my other device here, this phone. So I'm seeing it 310 stars. God bless you. Thank you. I really do appreciate this. Make they send me star. I'll talk about that later. Make una send me for YouTube, Facebook. I appreciate you, I swear. If you send me stars, you're encouraging me to stay on this platform talking to you. So let me go back to the question here. Um, so there are different types of cancer. Now, cervical cancer, for every woman listening to me here, if you are sexually active and you haven't screened yourself for cervical cancer, I would encourage you to do so. Please try to get yourself screened for cervical cancer. Very important. Then for the men listening to me, you can also screen yourself for prostate cancer if you are above 40. And then if you have a family member with cancers like colorectal cancer, what again? What again? Which other type of cancer again? Or ovarian cancer? Please, I beg you, go for your normal screening. Speak with your doctor. Okay. Please, for someone to be hearing the sound of the heart very loud and clear, is it normal? No, it's not normal. That's called palpitations. You shouldn't be hearing your heartbeats. You shouldn't. You shouldn't. You shouldn't. You shouldn't be hearing your heartbeats. No, it's not normal. Hmm? What can be done to stop recurring of yeast infection and vulvar itching? Have you seen a medical doctor? Gift. Have you spoken with a medical doctor? Yes or no? Have you spoken with a medical doctor? Gifts. What's your name? Let me see if anybody has sent stars here. Let's see if anybody sent stars on this other one. I don't know how to send stars. You want to send me stars? Sarah Bassi. Sarah, is that you? Sarah, is that you? If you want to send stars, look at, see, on the comment section here. You see this thing here? This thing, this star sign here. Yeah, click on it. If you click on it, it will show you this. Let's see. Yeah. So that's how to send stars. Very good. So if you go below to the comment section, you will see this star icon. Click on the star icon there. This star icon, no, this one. Very good. So to stop recurring yeast infection, you have to find out, are you taking the medications prescribed for you by your doctor? Number one. Number two, um, are you sure you are treating the right thing? Number three, are you sure you're not having resistance? Number four, is your partner also on treatment? That is, if you have a partner. Number five, maybe you might not even need you might not need what we call antifungal agents. Maybe you might even need probiotics. Who knows? Okay. And when I run for whenever I run or bed for long, I will hear the beats and it gives me headache at my left eye side. Florence, I feel that you should be speaking with your doctor. Did anybody send me stars? Did anybody send me stars? Let's see. Let's see. Did anybody send stars here? I want to appreciate you in case you send me stars so that it won't look as if I'm ignoring you. Okay. So Florence, this is not normal, though. It's not normal. Though when you run, your heart rate would increase. It's a normal response. It's a sympathetic response. Your heart rate increases when you run, when you engage in activities. However, if you know that you are not doing anything strenuous, anything that has to do with energy, and you feel your heartbeat, you are feeling it, you are hearing it, you should speak with your doctor here. Yep. Okay. Let's see. Let's do this. My sister is trying to get pregnant. She has seen a doctor. She did some tests and scan which shows is very okay, but one of the person that did on the scan said something about her uterus being upward and that she might have because getting pregnant, and she's very worried. So Melissa, calm down. This is what I'm going to advise you. Rather than your sister getting worried, your sister should be asking her doctor these questions, not listening to the person that did the scan. If her doctor examines her and says that everything is fine, she should relax her mind. But there's something you have written here that is making me worried. You didn't make mention of your sister's partner. You only mentioning your sister. So is your sister going to see the doctor with her partner or she's going alone? Who they put angry sign for my live stream this night? Who be that? So Melissa, is is your sister going alone, or she's going together with her partner? Because if she's going alone, that is quite very wrong. She should be going together with her partner. Yeah, that's my advice. Maybe the fault is not even from her. I'm just saying. At times, I feel headache on my forehead. At times, I feel headache on my forehead, turns my eye. Oh, this is not cool. Um, it's not cool. Headache turning your eye, you should be examined, because we don't even know more about your headache. We don't know anything about the headache. We don't know the duration. We don't know if you have any other symptoms. Though you have one, dizziness, which is not right. This is not the kind of style. Yeah. Okay. If you are just coming, you are welcome. So, Mr. John, thank you for the stars you sent to me today. I appreciate you, sir. Thank you very much. Mr. John sent me 310 stars. God bless you. Amazing Grandma's channel. Hi, good evening. Thank you. Who else is on YouTube? YouTube people no one send me super chats. Huh? Okay, I've answered you. I have, if I've answered you, I've answered you, I've answered you. Yes, I've answered you. Who is not this kind of star? Oh, not be this star, I beg you. Not this type of star. Yeah? Not that type. Not that you start counting 300 stars. I only hear it when I'm working or doing house chores. Just go for general examination. Go for a general examination or normal medical examination. Let them check you. If they check you and there's no problem, you're fine. You go home. Madam, I'm supposed to make a video. There's a trending issue going on right now. Um, Michael Jackson's ex-wife passed on. She was fine. Suddenly, she had a cardiac arrest and she died. There are so many people like that looking very fine but have one or two problems. So I'm not going to come here and say that everything is okay. I believe you should go get yourself checked. If everything is fine, they will tell you at the hospital. Mekuna, okay. Chioma, how are you? Um, Doc, can somebody get pregnant when having ovarian cysts? Yes, it's possible. It's possible. Oh yeah, share the live stream. Share the live stream. Share the live stream. Share, 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 share. Everybody is just interested in asking questions. Nobody wants to share. Thank God Mr. John sent me. Mr. John, you have not asked me question today. Oh. You sent me star, but you don't want to ask me question. Okay, I've seen your question. Yes. What can cause you to have pains on the right side of your stomach? So the stomach is a part of the abdomen. Are you talking about the stomach or you're talking about the abdomen? If it's the abdomen, the right part of the abdomen, it could be upper, mid portion, or lower portion. And even the abdomen is not right and left. We have the right, we have the left, and we have the mid portion. So if you're having pain at the right side of your abdomen, we don't know if it's at the upper part, if it's at the lower part. I'm not here to diagnose you. This is not a clinic. So there are many things in the right side of your abdomen. It could be from the liver, the gallbladder, a part of your intestine. Um, it could be from the kidneys. Do you understand? At the right side, it could be a mass. It could be a functional problem. Don't worry. This is a big. Just forget that word. Functional issue. So I cannot tell you exactly what is causing you right-sided abdominal pain. It could be that now the muscle they even pain you, or maybe now the nerve supply. So there are many things at the right side of the abdomen. If it's up, if it's low, it could be from the bladder, a referred pain. So, bro, there are many things that can cause you right-sided abdominal pain, and I cannot come here and say the cause of your problem is from your kidney. God forbid, when I don't know anything about your history. Does that make sense? So there are many things at the right side. If you divide your body into two now, right and left, on this right side, there are so many things there. Okay, oh, who else don't send me stars? Nobody don't send me star again. Okay. Uh, I always repeat it. This place is not a clinic, so please Don't ask for medication. Don't ask for diagnosis. I'm just here to educate you. That is all. Good evening. What's the cause of noisy stomach? And your intestines are moving now. Your intestines are moving. Good evening, doctor. I want to ask, is there any benefit of alcohol in the body? Because I normally take 2 bottles in a week. That means 8 in a month. Is it not too much? Alcohol has no benefits. Alcohol has absolutely no benefits. If you want to take alcohol, you're taking it because you want to take it. Do you understand, sir? Alcohol has no benefits. No benefits. Don't allow anybody to tell you that I hear say if you take it will help you for the heart. It's a lie. If you want to help your heart, stop smoking, stop taking salt, exercise, take fruits, cut down on caffeine, cut down on high cholesterol food. Your heart will be fine. So don't come and lie that the reason you're taking alcohol is because of your heart. It's a lie. All those one are olden days scam. Make una share the live, guys. I want to end the live stream. What's the difference between implantation bleeding and period bleeding? Oh God, I beg. Oh. Implantation bleeding means you are pregnant and your baby, your fetus, wants to fix itself in the wall of your uterus. Blood will come out. Implantation, the woman is pregnant. The egg, we don't fertilize, wants to fix itself in your womb. So as it's entering inside the womb to stay there, little blood will come out. Very little, not much. Fine, that is implantation bleeding. To implant, to stay inside, to fix itself on the wall of the uterus so that the baby can grow. Period bleeding, you are not pregnant. The uterus inside is coming out, is removing the thing, blood is coming out. There is no pregnancy. Implantation, there's pregnancy that wants to stay. Oh, God. What is the cause of nose bleeding? Recurrent nose bleeding should be at the hospital. If that is what you have, every time your nose they bleed, you should be at the hospital immediately. But sometimes people can just bleed occasionally, blood come out from your nose, no problem. Just apply pressure over the nose, it will stop. Sometimes the blood vessels over your nose can get ruptured a little bit and blood will come out. You understand? Now, everything I'm doing on this live stream, guys, let me say this before I continue. Um, Everything I'm doing on the live stream, I'm cracking my head, trying to answer your question, trying to ensure that I don't say rubbish online. It would be totally unfair, to come online, answer, yet you know they share the live stream. It's totally unfair. This is one reason why I don't do private chat. I don't give out my number. You cannot give yourself out for people like this, answer their question, try to help them, and they will not even help you share your live stream, but they still want to take your time. So please, I beg you again, I beg. If you are listening to me on YouTube, on Facebook, I beg. I know they do gra. I know they do open eye. Now beg, I they beg you. Share the live stream. Then, if you want to support me again, you can send stars. Other big celebrities they collect star on Facebook. Now me know they collect star. Thank God for Mr. John that gave me stars today. Okay, I beg you. Please, there is something I noticed from my left hand brace in chimney. Also pen. Do you know? Do you need pool? I'll be bringing us. Oh my God, this is not clear. What's your name? Please, sir. There is something I noticed from my left hand breast. Is it breast in is also paining me. Is it pain? Do you need? Oh God, I'll bring it out some sort of. I'm sorry, my dear. I'm trying to break down what you're trying to say, but I can't. No vex. So try again and help me break it down. Thank you for introducing. Which one is that? Joyce, how are you? Doc, don't be angry. Oh, when I mean noisy, I mean I used to feel a heavy moving sensation. Okay, heavy moving sensation. Heavy moving sensation in the stomach. Heavy. So there are many things involved, madam. When you say heavy moving sensation, is it when you've eaten or before eating? Does it occur any time of the day or there's a certain time of the day it happens? Does it cause you pain or no pain or you just feel it no specific time? These are very important stuff. Do you have abdominal swelling? Does it affect you going to toilets? Does it make you feel like you want to vomit? So these are very important things I'm asking. This is how doctors arrive at diagnosis, though not exactly like this, but a process. You understand? So noisy, maybe you never chop, or you chop, or you belly they pain you, or belly they swell up. Jesus, that pot of beans, I never watch them. I never watch them. Go watch them. God. Oh God. Okay. Good evening, DK Roots. Thank you. Thank you. Thank you. Okay. Who else send me stars? I'm ending the live stream very soon now. No more stars, Abby. Nobody send me star again. Okay. Let's be sure that let's be sure I didn't miss anybody's stars. Oh, let's be sure I didn't miss anybody's stars. Oh, okay. Let's see. Let's see. Let's see. Okay. I didn't miss anybody's stars. Very good. So as I prepare to round up tonight, hmm, please, once again, I always say this whenever I come online. Please, please, and please, and please. I don't give out my number. I don't do WhatsApp chats. I don't. I just come online. I answer your questions like this. I make videos. I educate you, and I live my life, my private life. But if you come online and say that you want to call me, I know they do them. I know they do them. No vex because the moment you start them, everybody will abuse your time. The only thing where they do, they say, they do online consultation. So click on the link on my page. There's a link on my page. Click on that link, book for consultation. You will pay for the consultation, and then somebody will speak with you. You understand? Tell you what to do, and case closed. Other than that, I know they give my number. Or I know they do come and chat me in the inbox. I'm very clear on that. And the social media where we did so it look good, but at the same time, the social media can give you severe problems. You understand? Yeah. I'm rounding up tonight. I'm rounding up tonight. Did anybody send me stars? Did anybody send me stars? Let me see. Oh, let me not miss anybody's stars. Oh, make I not miss anybody's star. I beg. Oh, let me be sure that nobody sent stars and I missed it. Please, dog. What could be the cause of heart beating hard as if something happened and I'm scared, but nothing is wrong with me? I have checked my BP and was told it's normal. And so that is what we call like a panic attack. Mary Jane, most likely, I'm not making a diagnosis for you, but that is what we call most likely a panic attack. Speak with your doctor, my dear. Your BP will be normal. Most cases in panic attack. Panic is called like panic attack. Why are you having panic attack? You can't really explain. Hmm? Speak with your doctor so they can help you. I'm rounding up tonight. Doctor, do you know if someone usually comes days prior to my ovulation? Like right now, I'm feeling with slight abdominal pain. Hey, madam, if it's your ovulation, then it's normal. That's your body. Yeah? Messy. If it's close to your ovulation or your ovulation, now your body be that. Do you understand? Yep. Okay. Lagos, London. Offering, how far now? Doctor, does blood pressure naturally rise during the afternoon daytime, even for someone with normal blood pressure? Sometimes, but not every time. Your blood pressure should not rise if you are fine, you're normal, no issue with your blood pressure. It shouldn't rise. So if your blood pressure is going up, it means that the BP is going high. It's not because of morning, afternoon, evening. It's just that you've taken note of that in the afternoon. But in the afternoons, most times you are active, you are working. So the blood pressure can little bit go up. When you sleep at night, you wake up in the morning, your blood pressure usually comes down normal. I won't end though, I don't tire. Good evening. Is it true that headache or stomach ache will be disturbing someone that has CS? Sometimes, sometimes because of the procedure carried out on the woman for the cesarean section, she can have headache, what we call spinal headache. What we call a spinal headache. If it happened to her doctors will explain to her and help her. Okay, I won't disappear. My sister for 7 years now have not sex. Not now. She's sick and have body pain. She don't know what to do. Her husband traveled far. My dear, the reason for your sister having body pain is not because of the sex now. It might be a normal or something else causing her problems. Please, oh. Because your sister have not had sex for 7 years, that is not the cause of her body pain. It might just be something else causing her body pain. Please. So don't put her diagnosis on not engaging in intercourse. So before I end this live stream tonight, I want to collect next about 200 stars, and then I will end the live stream. Oh yeah, make some people send me stars. Then I close. I did not say you have panic attack, madam. This is why I don't mention diagnosis online. This is why I don't mention diagnosis online. The moment you mention diagnosis, somebody begins to tell you that that is what I have. I beg you, please, madam. Speak with your doctor. I didn't say you have. I'm just saying it might be a panic attack or something else. So please, I beg you, go and speak with your doctor. Hmm? Oh yeah, somebody should send me stars before I end. No stars, I don't go. Multi law portable go say na wahala, 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 wahala. Okay. Uh Anybody asking me questions on period, please go to my YouTube channel and watch the video. Please, guys, go to my YouTube channel. If you have any questions on period, please go to YouTube channel and watch it. On this live stream, people know we share the live. It's well, we thank God. Mr. John, I don't know if you are still here. Let me appreciate you one more time. Thank you for the stars you sent to me. God bless you. I appreciate you so much. And if you want to have a private chat with me, click on the link on my profile. Then, if you want to sponsor my live program every Sunday, send me a mail. Like I always say, good life now waiting. Good life. Good life now sense. When are you coming online again? So, yeah, you are here. Yes, thank you very much for the stars. I might be here tomorrow. Yes, I might be online tomorrow evening. Hopefully, I'll be online tomorrow evening. Hmm? Yeah, I will try to be online. I try to come online every day, even if it's 30 minutes or 1 hour. I try my best to do that every day. So sometimes I might not be able to come online. But sometimes you'll surely see me online. Anytime you see me online, we give glory to God. If you can't find me online, it means I'm tired or I'm very, very busy. Hmm? Yes. So let me allow this ad showing on my live stream, and then I disappear. See, there's ad showing. See, there's ad. See ad showing on the live. You see it, Abby? Yeah. Okay, ladies and gentlemen, thank you. They should turn on their live notification. Oh, yes. Please, everybody, turn on your live notification. Turn on your live notification so that whenever I come online, you will be notified that I'm live. So everybody listening to me right now, if you have not liked my page, go online, go up to my profile, click on the like button, and turn on the notification. How will I get you on YouTube? It's the same username on YouTube. The same. It's the same. It's the same. Lillian, it's the same username on Facebook, on YouTube, on Instagram, on TikTok, on Twitter. It's the same. Doctor Fredostar. Just one Doctor Fredostar. Yeah. Everybody, I'm signing out. Thank you once again. Take care of yourself and have a love. This ad never come out. It's still appearing on the screen. Make I let this ad show. This ad now small money. This ad right there. Eh? Even if now $0.01. So I'm gonna wait for the ad to get off of the screen. Joseph, I'm doing very well. Good evening. Good evening. Yeah. Okay. Let's see. Let's see. Okay, let's do this. Okay, oh, you don't come out. Good. So thank you, everybody. Take care of yourself and have a lovely night. Take care. I'll see you all tomorrow. Bye bye.